Welcome to New Hampshire's Business. I'm Fred Coker. Let me show you a quote from my guest. It is increasingly impossible to recruit and retain caregivers at all levels of care in New Hampshire, whether for in-home care, in long-term care facilities, or in hospitals. That's from Brendan Williams, the president and CEO of New Hampshire Healthcare Association. Now, long-term care in New Hampshire that he has written about. New Hampshire reimburses less for Medicaid than most other states, $49 daily for 24/7 assisted care, 4,500 Medicaid patients in New Hampshire nursing homes. And this. New Hampshire legislative study recently says continuity of care is essential to quality care, but Medicaid payments are sufficient. Business Industry Association of New Hampshire says let's increase Medicaid to providers. Now, by 2022, the number of healthcare workers needed will exceed the number of K through 12 teachers in the U.S. That's just really amazing. With me is my guest, Brendan Williams from the New Hampshire Healthcare Association. Welcome.
Thank you very much.
Nice to have you here. Just how serious is this shortage?
Well, it's a real crisis. We're the second oldest state in the country, and we have a real problem holding on to staff right now because of the Medicaid reimbursement. Over 3/5 of the patients in the nursing homes are on Medicaid, and the reimbursement falls far short of paying their costs.
And you represent in your association who?
We represent assisted living facilities and skilled nursing facilities.
Okay.
Yes.
I'm going to ask you about the state government's role in a minute, but what's being done by the hospitals and the home care associations and the assisted care facilities and nursing? What are they doing to try to recruit talent?
Well, we've been working in concert with policymakers to create awareness of this issue, and there's been some studies that have been done both at the behest of the governor and also by the legislature. Clearly, we need to make education more available to those who might want to enter some of the licensed professional positions. But, a big part of it is going to be Medicaid reimbursement.
Now, New Hampshire, that stat we just put up on the screen, $49 daily for 24/7 assisted care. That falls far short of what's needed, doesn't it?
Well, it's below a budget motel rate, and that is for 24/7 care, meals, and housing, and that's for assisted living facilities. It's really made it very difficult for those types of facilities to care for Medicaid residents.
The Business Industry Association has come forth for the coming session in 2017 saying we need to increase Medicaid reimbursements to providers, and I know what their concern is. It's the shifting of costs to the private sector, to businesses.
Right.
But this is significant, isn't it, to get the BIA in on this?
Yeah, we're really appreciative that they're focusing both on care for those who are on Medicaid, but also for on education and funding our higher education system more, because one of the challenges we have here in New Hampshire is holding on to our young people. We have this big exodus,
right.
And I think if they were able to get into the caregiving profession, that they would find that to be very gratifying.
The commission legislature created to look at this problem and said that Medicaid reimbursement as it stands is sufficient. How did they come to that conclusion when clearly from the numbers that you've given me, it's not?
Well, I think that they're going to get to a place in the legislature where they understand that the funding is not adequate to pay the costs of care. We have a red hot service economy, which is terrific, 2.8% unemployment rate. But that competition is really tough for healthcare providers right now.
Finally, Obamacare clearly is going to change with the new administration, the Trump administration, and the Congress. What's your concern there?
Well, that's going to have a big effect on hospitals, and we're long-term care facilities, but I think any strain upon the system is bad for the entire system. So I think it's going to be a test to see how we accommodate some of these changes at the federal level. We're worried about the idea of reducing Medicaid funding to the states through what are called block grants, and that would really have a disastrous effect here in New Hampshire.
Brendan Williams, President and CEO of the New Hampshire Healthcare Association. Thank you.
Thank you.